Hi guys. So my husband and I have been in conversation about the whole issue of illegal immigrants and everything that really comes with the whole story of the healthcare system, yes, in South Africa, and the fact that South Africans have moved to saying that illegal immigrants must not be given access to healthcare. And we've heard some people quoting Section 27 and saying that they're using that as a basis for an argument to say that everyone is given a right to healthcare, even though that everyone is also subjective. And many of us know that it refers to South Africans because, first of all, if it didn't refer to South Africans and it really was talking about everyone, then the Constitution would not have made provision for medical insurance, for example, for illegal immigrants, foreigners, and then for illegal immigrants to be deported and given only emergency healthcare. So why would the Constitution do that and then turn around and say it includes them in everyone? And also it didn't even make reference to which specific kind of medical healthcare in terms of public or private. But anyways, that's a different argument. My husband is actually telling me about a case that is called the Subramani case. Now here is a very interesting case. Let me tell you why. Now, Mr. Subramani is a 41-year-old man. He is unemployed and he suffers a renal heart problem and suffers a stroke, has a kidney problem and needs a dialysis. Now, when he needs a dialysis, he goes to Eddington Hospital and he tells them that, listen, guys, I need an emergency admission because I have a problem with my kidneys and therefore I need a dialysis and the hospital is like, sorry, we can't make you an emergency because there's other patients, and when there's other patients, we have to prioritize them because they're also like in dire need of healthcare. And he's not happy with this, so he takes the matter to court and tries to force Eddington Hospital to prioritize his medical health care because he feels like he is an emergency patient, and mind you, he is a South African. When he goes there and he asks for this court to hear him out, his argument is obviously Section 27 that everyone is quoting, the right to life, right to healthcare, right to housing, etc., etc. Now the hospital, their argument is that, listen, we know that you're not well and we wish we could give you the dialysis that you need so urgently. However, we can't because we've got other patients and we don't have enough machines. We've only got 20 of them, and when we have 20, we can only take that number of patients, and even the 20 machines that we have, they don't function as well as they should. So the resources that we have are quite limited. Now, when you think about it, the state is supposed to provide Mr. Subramani with this dialysis that he needs because, you guys are saying Section 27 is quoted in the Constitution. Now, the problem is he actually didn't win this case. And the reasons for that were because the court found that in as much as Mr. Subramani has a right to life as quoted in Section 27, etc., etc., however, the most important thing as written in the Constitution that accompanies Section 27, which means you can't just read Section 27 by itself, it is accompanied by a clause also that says that this is also depending on the available resources. Now, this is groundbreaking for all South Africans because you can get medical care, but it depends on the available resources. Izobe provided this healthcare for free, and it's going to be used from taxpayers' money, and it's a situation that can actually force a government to have extremely limited resources, which is where we find ourselves in at the moment when it comes to illegal immigrants and South Africans, which is why there is this huge struggle between South Africans and illegal immigrants to access resources. Now, the interesting part is that our government wants us to believe that they are forced to provide healthcare as of Section 27, but they completely ignore the part that says, depending on your available resources. And we all know that right now there are no available resources, because you'll go to a hospital, there'll be no pills, there'll be no beds to sleep on, there'll be other things, and there'll be a long list of people waiting to access resources that they ideally should be getting but can't because they are not available. So why are we still fighting with our government to get rid of illegal immigrants? Because the simple argument is that we no longer have resources. The resources are no longer available. So thank you, goodbye. Please go and access them in your country, because South Africans cannot be not prioritized for illegal immigrants. So there it is, South Africa. Your government has been putting you second when they've got the option to actually put you first, by simply saying, we do not have enough resources to accommodate the whole of South Africa. So therefore, our constitution says, if we do not have available resources, then we can simply say, no, we don't have medication or whatever it is that you need for you. Section 27 doesn't go by itself. So I don't understand what kind of government is the one that will keep on highlighting Section 27 and deprive its own people of medication, of things that they should be accessing in terms of healthcare, when they can simply say, sorry, we would love to help you, but we can't because we don't have enough resources. Section 34A says of the Immigration Act that South Africans or anyone is not allowed to help abet or anything an illegal immigrant. You're not allowed to give them housing. You're not allowed to do this. Why are we ignoring this important part of the Immigration Act and allowing our government to give these people houses, to give them beds, to give them this and that? So South Africans, time for you to stand up and do the right thing, because if you have been deprived of a bed, deprived of medication, deprived of anything, and you know for a fact that this has been given to an illegal immigrant who by right is supposed to be getting deported by our government, then you possibly have a leg to stand on to take that same government to court. And if they insist and keep on pushing for South Africans to be forced to share these resources with illegal immigrants, then the whole of South Africa needs to sue the entire government of South Africa, especially if you're in need of healthcare or any of these important resources that they are giving to illegal immigrants, because our government is the one that's breaking the law. So stand up, South Africans, and let's march and march until we win. We can no longer be second-hand citizens in our own country. It cannot be. It cannot be. It's time for us to stand up and fight until the end. There's so many things that they can say and do that can support the clauses in the Constitution that can make South Africans be put first. But here we are stuck with a government that is not willing. So if you are saying that you are removing people who are putting themselves first in hospitals and clinics, government, then you need to be the one that is taken to court and arrested for all the lives that are lost, all the pills that people don't get, all the resources that they don't access, all the people sleeping on the floors, on the bed, because it's you, government, that is enabling that. You have a choice and you have a right to say to people, we don't have resources. Thank you. Goodbye.